Hello, I'm Raj Shah from the University of Colorado Hospital, where I'm professor of medicine. And on behalf of my co-authors, I would like to discuss with you our article titled Per-Oral Video Cholangiopancreatoscopy with Narrowband Imaging in the Evaluation of Indeterminate Pancreatic and Biliary Diseases. We conducted this study at the University of Colorado Hospital over a 9-year period. The instrument that we used was the Olympus Video Cholangioscope with narrowband imaging technology that was on loan to us. And at the time, the technologies available for cholangioscopy was quite limited with respect to image quality, and that's the main reason for us to conduct this study. We had a very highly select group of patients. Overall, we evaluated 109 patients. We excluded those patients who did not have the procedure specifically to evaluate for indeterminate stricture. There was a total of 96 patients included in the study. Predominantly, these were patients with biliary tract disorders, 80% of whom had previous non-diagnostic sampling by ERCP or endoscopic ultrasound. What we felt was unique about this study was that we attempted to categorize and classify different findings in biliary and pancreatic ductal imaging, and myself and my late former colleague, Professor Young Chen, together with review of previous literature and our own personal experience with cholangiopancreatoscopy, came up with 9 criteria that we thought were suspicious for neoplasia. And of these 9 criteria, we found 4 that appeared to be more indicative of neoplasia, and these were statistically significant compared to the other both neoplastic and benign findings in our study. The unique aspect of this study is that the image quality was a video where the CCD chip is on the tip of an endoscope that's used for entry into the biliary and pancreatic duct. It's part of the more historical mother-daughter type system. This was the first video study in which we were able to categorize these lesions in a U.S. patient population and then see and stratify these patients for risk of malignancy in this retrospective study. Of the 9 criteria that we were identifying, we found 4 that appeared to be more suggestive of malignancy, and they included infiltrative stricture, dilated tortuous vessel, which is a tumor vessel, and this has historically been called a tumor vessel. With respect to the infiltrative stricture, we clearly defined these as being an irregular margin, partial occlusion of the lumen, and asymmetry. And that's how we defined an infiltrative stricture. The third criteria that seemed to be more statistically significant for malignancy was a polypoid or vegetative mass, and lastly was a fish egg lesion. Overall, in our video cholangiopancreatoscopy impression, the sensitivity was 85% and specificity was 84%. When we added directed tissue sampling to that mix, then the specificity was increased to 97%. So we believe that this adds to the existing literature on cholangiopancreatoscopy, primarily because it allows hopeful future studies to look at incorporating some of these, or maybe even attempting to incorporate some of the terminology and characterization of lesions that we will see on cholangiopancreatoscopy. And the reality is that more and more individuals are performing cholangioscopy in the U.S., both in academic referral centers as well as in private community centers, and these are all fairly experienced ERCP physicians. And what we're hoping to add to the knowledge base is that these specific findings may be more associated with neoplasia, and what's really necessary is prospective, hopefully multi-center studies utilizing video cholangioscopy. Currently it's not commercially available, but hopeful that this will become commercially available and more widely available. But perhaps even though the video cholangioscope is not commercially available, with the digital single-use catheter-based system, perhaps this will translate the better image quality from video to the digital. That remains to be seen. But perhaps in the prospective studies, they can utilize these characteristics and validate them. But in conclusion, I'd like to state that our study findings showed an overall excellent yield of cholangiopancreatoscopy in detecting malignancy in patients who've had a previous non-diagnostic workup. And we find it to be a promising technology and await further studies in collaboration with other investigators to hopefully validate the study findings. Thank you very much.